Learn all about the world of healthcare recruitment and how you can help ensure the NHS and private sector have the staff they need to give patients the care they deserve in this episode of Future You. Hello and welcome to Future You, the podcast from Graduate Careers Experts Prospects. We're here to help you achieve your career goals. My name's Dan Mason, and in this episode we're delving into the recruitment sector, in particular healthcare recruitment. Globe Locums is a specialist healthcare recruiter based in London. I spoke to contracts manager Isabel Kiff, who joined the business as a graduate herself, about what the job involves, why she would recommend it, what skills you need to succeed, and how the organisation has met the challenges of the pandemic. Without further ado, here's Isabel.
So I'm Isabel. I head up the contracts team here at Globe Locums for AHP and HSS. Globe Locums in itself, we started off being pretty bespoke, just sort of specialising in echocardiography and radiography, sonography, so sort of imaging. And now we've branched out to be able to cover sort of the full comprehensive works of allied health professionals and healthcare sciences. So everything sort of from your physiotherapists, your occupational therapists, speech and language, dietetics, a real broad range of everything, and supplying these staff in temporary and permanent contracts into the NHS and private sector across the entirety of the UK. We also sort of have contracts and pipeline to Australia, New Zealand, and Europe as well, so we're not just UK focused.
Okay, that's great. And could you tell us a bit about your own background? Because I understand you yourself joined as a graduate as well. So what were you studying? What were your career ambitions at that time? What attracted you to Globe Locums?
So I did a psychology degree at University of Essex. Got a first degree there, chose psychology. I think like a lot of people, I didn't know what sort of focus I wanted career-wise, and everyone sort of always says psychology brings out so many different skills for sort of a diverse range of careers. So I kind of did my undergraduate degree there. Got to sort of final year, exams were coming up, and I started stressing, thinking I'd realised I didn't want to carry on in education. So I was like, right, I want to make sure I've got a job from when I graduate. And to be brutally honest, I wasn't really sure what I wanted to do. And I know there are a lot of graduates out there that are sort of in a similar boat, and especially with a psychology degree, it doesn't link you to a career. So although that was the reason I picked it, at the same time, after 3 years, I was kind of left thinking, where do I go from here now? So I've been doing some research, and I'd always had a big passion for healthcare. I'd had sort of previous aspirations to be sort of in paramedic or in the NHS generally, in a clinical role, some form of somewhat. But I just obviously hadn't gone down that route, and I was in a bit of a muddle, didn't really know what to do. Started looking online, and I noticed a lot of recruitment jobs were coming up, and I think for me, I hadn't thought at all of ever going into recruitment. I think, especially back in the day, maybe not so much now, but there was a bit of a bad stigma with recruitment. I don't know, it just all my friends were like, oh no, I wouldn't go into recruitment, I hear it's really hard and, you're not treated very well.
Sure.
And so I was like, oh, I don't know if I want to do that. And then just by chance, I actually saw a healthcare recruitment job. So I was just sort of reading up on it, and Globe's sort of mantra and ethos, although it sounds really cliche, I just thought I really aligned to it. And obviously, although I knew I couldn't be clinical myself, I thought, well, this is some way to kind of give back to the healthcare sector and sort of help support from sort of a different sort of aspect. So I know that's a really vague answer, but I was never like, I'm going to have a career in recruitment. I never anticipated on it at all. But that was back in 2013, and where we're now, 2021. So, 8 years later, I'm still here, still at Globe Locums, and still really enjoying it.
So presumably, given that you're still there after all those years, all those preconceptions that you had about recruitment and things that people had told you have proved to be a myth, or at least at Globe Locums.
Yeah, completely. Like, I can't recommend sort of a career in healthcare recruitment. I don't know about, like you say, the other areas, the stigma may still exist there. I don't know, but for me, Globe Locums has been sort of one of the best decisions I've made, obviously career-wise, and also just sort of socially, just everything really. I'm sort of really happy with where I'm at, sort of the career progression I've had here, and kind of everything I've learned from being with Globe. So I think, yeah, it definitely gets a big thumbs up for me. And I suppose, like you say, the 8 years is sort of evidence of that, because I think recruitment is one of those things that you do learn pretty early on if you enjoy it or not, because it's one of those careers that you've not really had a chance to do until you're in the job, and you don't really know if you're going to enjoy it or not till you're here. And I know that sounds a bit silly, but it's such a separate job from so many other things you might do that I don't know, it's hard to explain. I think most people that join us thrive and absolutely love recruitment, but typically as well the same. Sometimes recruitment just isn't for some people, and they don't enjoy it. Just like any career, I guess. There's, not every career suits everyone.
Absolutely, yeah. So how would you sell the idea of working in healthcare recruitment to a current student or recent graduate who's like you at the time hadn't considered it before? What are the real the best things about this job?
Yeah, it's a good question actually. One of the things that I've always loved, I've always worked really hard, and I've always thrown myself into something like with 110%. And I think recruitment, one of the good things is it is rewarding in that sense that you do get out what you put in. Obviously we do have to work really hard, and some of us stay longer hours, or are on our phones outside of work hours, and that's a personal choice. That's not sort of a contractual choice. But you do find those that do go the extra mile and put in the extra work do get more rewarded for it. And I think it is really nice, that aspect, because I think we've all been there perhaps where, even before Globe Locums, when I just sort of had a retail job sort of throughout uni, sort of working in a shop. And I used to always think, I work so much harder than so many other people here. And obviously you both get paid the same amount of money, and you both get treated exactly the same. And it's not all about the money. Obviously there's other sort of rewards generally from doing well in your job, but you are really recognised here for sort of the work you put in. And I think that is one of the standout things in terms of career in recruitment, compared to some of the other jobs out there. And that was one of the main things for me. Also, I suppose for Globe specifically, like we're central London based, which won't suit everyone. But I knew I really wanted to work in the city. We're sort of in the hub of everything. So maybe not so much at the moment because of COVID, but pre-COVID, it's just a really sort of social, bubbly atmosphere. It's just a really cool place to work.
Yeah, that's great. And if we turn then from what might attract graduates to Globe and look at the other side, what you're looking for from new recruits. So what would you say are the key skills and characteristics of someone who's going to thrive in this environment?
Yeah, I don't want to sound too cliche here, all the classic sort of, someone that's hardworking and high integrity. I mean, obviously we're a healthcare agency, so, we are placing people in to help serve the NHS, serve patients and provide the best patient care. So integrity to us is so essential, because we're not just about finding someone, bums on seats, just getting them out working. We want to make sure we are placing the best candidate in the best job. And so high integrity and high morals for us is so crucial. We're not an agency where it doesn't matter who they get at the end of the day. It's so important to make sure we match correctly. And we do that because we want to, if that sort of makes sense. But there are the core values. You do have to be hardworking, and there is resilience. And I think that's something that maybe a lot of graduates don't realise. Recruitment is tough. A lot of people just think we just find people work, and that sounds relatively easy, but there is a lot of rejection, there is a lot of knockbacks, because you're working so hard sometimes to work for the client or to work for the candidate, and it doesn't always work out. You can't always get them exactly what they want, and you do have to be resilient to that, because I think it's one of those jobs that sounds easy on paper, but actually when you're in the office doing it, and like I say, with healthcare, there's, at the end of the day, we're accountable, because if we can't find candidates for these jobs, that there's patients waiting. So it is high pressure in that sense. I'm probably making it sound a bit doom and gloom, but from that it kind of gets the excitement. But I think people sometimes come into recruitment thinking it's easy, and I do think we need to have sort of the realistic graduate that wants to work hard, wants to do well, is driven and resilient. Also, we're really focused on, again, this sounds cliche, but we are a bit of a family. Our two directors, James and Gavin, Gavin's actually a clinician himself, which is where our core values have kind of been embedded down in us. But we really do want to hire people that get us and get our dynamic and get our values. And I think, we don't just hire someone because we think they're going to be excellent at the actual job. We also want to hire someone because we think they will mould well into us as a company. So just really friendly, personal people that want to do well. There's not sort of a core skill set in terms of, we'd expect you to have this degree or this level of qualification. We are always looking for someone, obviously we're healthcare based as well, so we are always looking for someone that has got the passion for healthcare and for the NHS. But like I say, they don't need to have a sort of specific healthcare background. It's just more about the passion from the person, really.
And how then do you assess candidates? So what's your application process if a graduate is interested in this and want to apply? What's the process? How do you assess them?
Yeah, it's relatively straightforward, especially if any graduates have sort of gone through some other sort of graduate scheme process. They can be quite labour intensive. Ours is relatively simple. Obviously submit your CVs. We're on sort of all the major jobs boards, or you can submit to us directly. And we review the CV, obviously just looking for your sort of key skills and how you present yourself on your CV. Again, there's nothing in particular we're looking for on your CV, and there's no pass or fail in terms of your experience. From that, we will then send you over sort of 4 or 5 questions just to gauge your sort of understanding and also I suppose your commitment. A lot of people do just send out hundreds of CVs and they don't actually take any acknowledgement of what job they're applying for. So we send sort of initially 4 or 5 questions just to make sure they understand the job they've applied for and sort of why they've applied for it. And if those come back, satisfactory, then we would schedule a phone call. And the phone calls mainly, to be honest, a lot of our time, a lot of our job is being on the phone. You do have to be very personal. We do have a lot of pre-COVID, a lot of face-to-face meetings, a lot of telephone conversations. There's a lot of sort of person-to-person interaction. And so we do like to call the prospective candidates just to make sure they are comfortable speaking on the phone and they're able to have a conversation with us quite freely. And then from that, any shortlist applications will then actually just be invited in for the face-to-face interview in our office in London. And that's when they'll meet with myself and they'd have joint interview with the directors and also some of our divisional leads as well. Just they can, also for the candidates, so they can kind of get a feel about who we are, and it's not just all about how good the candidate is. Do you know what I mean? We are quite 50-50 on the front. We want to make sure the prospective candidate feels like they're making the right decision as well. So we are very inclusive in terms of our internal interview and sort of who they speak to when they're here.
Fantastic. And so more of a traditional recruitment process in terms of CV, phone call, interview, as opposed to all the assessment centres and psychometric tests that a lot of other places do.
Exactly. No role playing, no group big Q&A discussion things. And don't get me wrong, some people absolutely love that and thrive off that. I wasn't one of those people. So just very traditional.
And so for those who are successful and join you at Globe, tell us about what those first few weeks and months might be like. What are they going to be doing day to day? What's the sort of wider culture of the business? What's it going to be like working for this business?
Yeah, so when you first start, you're buddied up, so you'll be given sort of a mentor. Obviously, you'll be put onto a desk. Obviously, I said we cover all AHP, HSS divisions. So the way we split it up isn't by sort of geographical locations in the UK, but it's actually just by division. So you might be placed on the physio desk or the radiography desk and any sort of AHP division. From that, you'll then be buddied up, so you'll have a mentor designated to you that's there at any time should you feel you need any additional support, but also just to kind of walk you through all our processes and training. The first few weeks might feel quite monotonous because obviously there's a lot of training to be done in terms of the software we use, how we use our equipment, and GDPR compliance. So the first few weeks you don't really get actively involved in the recruitment side of things because there is sort of a lot of the policies, process, induction training that happens, and that's sort of done with your mentor and also our HR and compliance team. But sort of once that's all completed, it's sort of it's kind of like a sink or swim moment. It sounds really silly. You're sort of thrown into the deep end, but thrown in with a buoyancy aid, because obviously with recruitment, you just have to kind of get stuck in. So, your mentor will be with you, but the sooner you kind of get on the phone speaking to candidates or speaking to clients, the more comfortable you're going to be feeling sooner rather than later, if that makes sense.
Yeah, you've got to take plunge at some point, haven't you, and get started?
Yeah, exactly. So we do try to do that early on, because I think otherwise, especially for some people, although they might be fine on the phone, that is still quite nerve-wracking when you're brand new. So we try to engage in that as soon as possible, just so, like the band-aids come off. Because I think once you've made your first call, you realise actually that, it's fine, and the nerves go away. So we try to get the candidates and the graduates sort of doing that as soon as possible. But I would say the first year is probably always the hardest, actually, and I'll be very honest, I suppose, for the graduates, because in recruitment you kind of build up your own reputation, and the candidates that work for you end up referring their friends, and kind of you become known in the market. Whereas obviously when you first start as a graduate, nobody knows you, which sounds really sad, but like none of the clients will know you yet. They'll know us and they'll know the brand, so you're never sort of cold calling. Obviously it's always warm calling because people know us, but it kind of takes a while for people to start coming to you personally. But then that's in itself really rewarding. I remember when I started as a graduate, phone calls would be coming in from my colleagues, and emails would be coming in from my colleagues, and not much would come in for me. But I remember the first time like a major NHS trust called in, and when they asked to speak to me, and it was like really gratifying. I know it sounds really silly, but you start thinking, I am making progress here, and I'm starting to be remembered and recognised. So I do always like to say that, because I think, when you first start, it is the hardest part, because you've got to start building up that pool. But it happens. We're a really established framework healthcare provider, so it's not hard to make those relationships. It's like I said before, you've just got to be prepared to sort of put the effort in the initial stages.
Just thinking about the last sort of year and a half in particular, obviously it's been a big, eventful year for anyone working in any aspect of healthcare. How has that impacted on the recruitment side? Healthcare recruitment's obviously a bit different from, frontline healthcare work, but how have you and the business been impacted over recent months?
Yeah, to be honest, it has been crazy. The team have been working flat out, because obviously when lockdown first happened, like I said, all the non-urgent sort of lists got cancelled and postponed, and there was a little bit of uncertainty. We were like, what's going to happen here? And then obviously it's all just gone absolutely crazy for us, because there's such a huge backlog now of all these patients that weren't able to be seen in the initial lockdown. And so in terms of staffing, we've never been busier. We've never had so many vacancies to fill, which is great from the business side. In terms of there's a lot of work out there for our candidates, and we're able to make sure we find all the workers that come to us a position that they want. I suppose on the flip side, obviously it is really challenging, and it's I don't even know what the word is, but it's sad to see how many vacancies there are. It's kind of like a counterpart. Obviously, it is really good as a business for us, but it is crazy when you see sort of that sort of directly resulted from the pandemic now, sort of how many vacancies there are. So it's been really challenging, but we're really proud to sort of be part of the effort from our side to be able to get as many workers out in employment as possible, and sort of support as best we can. So it's something that we're proud to be helping with. It has just been incredibly challenging.
Yeah, not surprising. And probably an area that, when people think about healthcare, probably the recruitment side isn't one that, comes to mind immediately when you're thinking about that kind of thing.
Yeah, definitely. And I think it's hard, because there's so many, you want to help everyone. And there's, there are so many hospitals looking for work, and there isn't, there's lots of candidates, but there's still not as many candidates as there are for the job. So it's been challenging from that perspective, because you do, like I said, like our values, like we do really want to help, and it's not for us, it's not just about filling jobs, it is about the bigger picture. Everyone has been working incredibly hard over the last sort of 18 months.
Yeah. And just finally then, just about the sort of longer term opportunities for someone joining Globe. You yourself, said you've been there 8 years. How has your own role evolved? And along with that, how can new graduates expect, if they want to stay for the longer term, what opportunities are there for longer term career progression?
Yeah, there's lots. So I, like I said, started out as a trainee graduate recruiter. Then sort of obviously passed my probation, was fully fledged recruiter, became a senior, recruiter, and I found for myself I really enjoyed the client side of things. Over everything else, I absolutely love the client side of things, and going into the hospitals and seeing how we can better support the NHS trusts and the private healthcare providers. And so I've actually developed now into a contract management role. So I actually don't actively recruit at all anymore. I sort of help with all the legal contracts, supply, I suppose you could sort of say business development, and also sort of on some level sort of operational management of the AHP floor. So, I mean, yeah, I've kind of gone through the ranks to a completely different role. And they are the sort of opportunities that are available to the graduates coming on at Globe Locums. I mean, some people, it's just what you want. Some people obviously don't have that drive to develop their career to a different level or to have a different job title. And, we've got senior recruiters that have been senior recruiters at other companies that have come here, and they just absolutely love just working in recruitment and in that job role. But there are so many different aspects of recruitment that you don't realise, like myself doing contract management, where you can step away from the recruitment side and go into a different career path.
Brilliant. Well, that's been a fantastic overview. Isabel, thanks very much for joining us.
Thank you so much.
Many thanks once again to Isabel, and I hope that has been useful or sparked an interest in this career path for some of you. All that's left for me to say is do head over to prospects.ac.uk to search and apply for graduate jobs and to find lots of careers advice, including on getting into the recruitment industry. And don't forget to follow Future You on Spotify, Apple Podcasts, or whichever is your preferred podcast app so that you don't miss the next episode. Finally, you can get in touch with comments, feedback or suggestions by emailing podcast@prospects.ac.uk. Thanks very much for listening, and I'll see you soon.